Shalom and welcome to Jerusalem Studio. Israel failed to escape the fate that has befallen many countries around the world as the coronavirus spreads, infecting more and more people in various continents. But for Israel, it is a unique problem because of the possible security and political repercussions. Here to talk about this concerning situation are Dr. Shalmon, who is the Director of International Relations Division in Israel's Ministry of Health. Welcome. I'd like also to welcome our TV7 analyst, Mr. Amir Oren, and Dr. Fadi Essmaeel, who is a research fellow at the Institute for Counterterrorism at IDC Herzliyah. Welcome. Mr. Oren, give us a broader understanding on this challenging situation vis-a-vis the COVID-19.
Well, Israel has been traditionally concerned with biological warfare threats and various countries surrounding it and hostile towards it. Indeed had BW agents. This fear has receded of late, but from time to time there are exercises and simulations in what is called black curtain in the Israeli military jargon. Israel is also, of course, the neighbor of both the Palestinian Authority on its east, the west bank of the Jordan River, as well as the Gaza Strip, which, of course, on various sides is surrounded by Israel, Egypt, and the Mediterranean, and therefore perhaps is more closed than other entities, but nevertheless could pose a health risk. And Israel in recent decades has encountered epidemics or pandemics such as the aviary flu and tangled with it. Now Israel is facing a unique situation. First of all, some Israelis have been checked for the coronavirus when they were abroad, and then they were brought over to Israel when they tested negative. Some of them later tested positive. There was also an Israeli who tested positive and stayed in Japan, later found to have recovered. But there were also tourists and other travelers who have come to Israel from countries where later it was found that the virus has spread. So the security danger is that the virus will spread into Israel from anywhere in the world, but especially from the Palestinian territories and Gaza. And the political problem is that next Monday, Israel is holding a Knesset election, a general election, and there could be either a real threat of the pandemic spreading, or also one or another political player trying to spread rumors regarding certain polling booths in which one party used to have a majority in earlier times in order to scare away voters. So Israel does have to contend with several aspects of this problem.
Indeed. Dr. Shalmon, to what degree should we be concerned about the situation in Israel right now?
Well, to a certain limit, certainly. It is a serious international global event. It is not yet a pandemia, but we are under severe preparedness in a case it would actually become a pandemia. Now, it's a unique type of virus, and it has different aspects which are different than other pandemic events in the past. And we are still in the scale of really trying to study more and to learn about this virus in order to understand exactly how does it spread, the epidemiology, even the clinical side of the disease, and of course in the future, hopefully to have a vaccine or a kind of a treatment for that.
Dr. Essmaeel, your understanding of the situation, you're of course also an MD and you've worked as an advisor on multiple situations in the United States to Congress with regard to medical related issues. To what degree do you see the current situation as concern out of ignorance, because we don't know enough about this virus. We don't know the true implications to it. I heard earlier from Dr. Shalmon that 27 days, which was circulating on the internet about possibly being the time of quarantine necessary, according to the Chinese, is actually false rumors, and it's 14 days. But to what degree are we in the process of understanding this?
Okay, you actually have asked me several questions.
Absolutely.
Let me just preface it. Knowing what I know about biological agents, I sleep like a baby. Wake up every 2 hours screaming. Not necessarily corona. I mean, so far the coronavirus situation, with all the uncertainties about the knowledge, is still not the worst that we have faced in the last 3 or 4 decades. It is not good. I mean, when there's very strong possibility there's some information hidden from us. I tried to tease some of it out, some of my contacts in China, but frankly, even they don't really know more than they do. We always try to read into the future. There are all kinds of mathematical tricks you can try and do, analyses. I've just, the other day, 2 days ago, I read an analysis, some regression analysis based on Boltzmann functions. People use really advanced mathematical methods to try and understand the pattern of the epidemic. And actually, when you read it in a very calm way and you follow the numbers and so on, it seems like it's going to be very highly inconvenient, but probably will die off within a couple of weeks because we're going to a warmer weather. And so every mathematical regression I've seen on it, whether Boltzmann or others, got us to about the end of March. But the question is how many others? How many other people infected we will have. So part of it is we don't know everything about the virus. It's a mutated version of corona. That is true. We don't really know what is the latency of it. We think it is 14 is enough. Maybe it's more. We don't really know. And so far, we don't really absolutely know what are all the possible ways for it to be transferred from one person to the next, with the next, possibly droplets, but most probably. But
At least it seems not to be Aryan.
Seems not to.
Seems not to.
You see, we always work in that with that uncertainty.
Wording is very careful.
Very much. The problem is the public doesn't really. It's normal. It's very highly technical, and that is one thing that I have to say from my background as a crisis manager. Only the other day I was in a university lecture, maybe a couple of days ago, and the lecturer there was all exuberant about how wonderful our crisis response was. It wasn't bad, but there's so much more we could have done, mainly in the area of rumor control, information control, and I'm not talking about necessarily about Israel, I'm talking about us, the medical community. We're very busy with the clinical side of scientific. I know that there's a lot of gap on how we outreach to the public, and this is a point that happens time and again all over the world, even in the most advanced jurisdictions in the United States. And this is a lesson we're learning in every one of these epidemics time and again, and we have to really take it to heart.
Mr. Oren?
Democracies have a hard time in isolating areas and quarantining individuals.
Of course.
It started in China, in a certain district, Wuhan, in a certain city of 11 million people. And the Chinese government, being as authoritarian as it is, could easily cut off all communications, all transportation, could have ordered people to stay home or else. And they obey. Perhaps there is also some national character which makes them obey more easily. In Israel, it is not so easy. People came from infected countries, came to Ben Gurion Airport, did not necessarily register, went home, took public transportation, took the train, took buses, and then you have to try and see who else was there. Now, in earlier simulations, when we talked about biological warfare, there were very, very scary predictions that some 2 million Israelis could be suspect of having been infected, not necessarily being found so, but people would not go to school. neither teachers nor school children. Of course, if they stay home, what about the parents? Can they work? So the government prepared some papers urging people to work from home. The economy would suffer. Right now, the prediction is that 1% of gross domestic product could be hurt by the virus. And what is even more problematic is that, as we all said, it's a global phenomenon. Now, we all hail the global village, and the world is flat. There are no more borders, multinationals. This is a very weak spot in which you can't close off your border. Really, there is no fortress Israel, no quarantine Israel. So we are simply bracing for the news of whoever came in and reported symptoms.
Dr. Shalmon, we heard Prime Minister Benjamin Netanyahu on several occasions talking about over-preparedness rather than under-preparedness, and really emphasizing the daily ministerial meetings and working between the health ministry and Prime Minister's office and the Ministry for Public Security and seeing how
It's all the
everything,
government, all ministries.
all ministries are right now involved. Okay. To what degree is this current operation, if you will, really effective from the understanding of being able to locate the challenges and dealing with them promptly?
Well, the fact is that we don't have even one case of infection in Israel, a kind of somebody that got the virus in Israel. Maybe it has to do with luck, maybe it has to do with preparedness. But we did take severe action. And as you had quoted the Prime Minister. And the reason is that at the bottom point, I guess the well-being of the Israeli population is more important than diplomatic issues, than even economical issues, than many other international and global issues. And you know what? I do believe that most of the countries which are involved in this story understand our acts. And we do have quite open discussions. I do have daily discussions with the Americans, with the Brits, with the Australians, and with even countries like Singapore and Taiwan, and of course many others. And that is part of a long-lasting kind of a bilateral connection that in this point is very important. And it's not only that we are asking them what they are doing, we are also explaining the reason why we are doing things. And I have to say that most countries understand. If you look what is happening now in Italy, for instance, and you were talking about mentality and culture. So things are actually working quite well now by the authorities in Italy. And, you know, we talk about Italians so free-minded, open borders. It's not much more than here. Just assume North Italy, open roads, no passport, nothing with France, Switzerland, Austria, Croatia. Actually, there are 2 cases now in Austria. We'll see where from. But in general, the Italian authorities took some, I would say, strict steps, and let's see how it works.
And with regard to the ability to really work in cohesion with other ministries, while at the same time barring certain countries from entering Israel, of course, there is South Korea, Australia you mentioned. With regard to Italy is also on the chapter right now. How expanded can this happen to the degree of would we eventually close our borders to every other country until this
We are
passes?
now in stage 1, where we don't have the disease here. And in that sense, we are taking action to avoid. If we would move to the next step and we'll have the virus here, that would be a different question, and we may take different actions. Now, it is, I would say, an unpopular step. By the way, we didn't stop Australia. Okay, but it's an unpopular step. It is an effective step. And we could talk about the West Bank, about Gaza. We have, I would say, a continuous connection with authorities there in order to avoid the virus being spread also there, because it's basically clear to everybody that if the virus would cross the Jordan River, all of us would be affected by that.
Minister of Health in Israel, Litzman, spoke about the matter of Iran being currently plagued with this virus. I'd like to ask you, Dr. Essmaeel, with regard to Iran, it seems that even the deputy health minister there has been put in quarantine. He came out and spoke about it to the media. But it seems like the numbers don't really add up. If a country that provides information about large numbers of infected with very small numbers of death toll, in Iran there are low numbers of infected with high numbers of death toll. So does it mean that the information there is not public because of the regime trying to calm the concerns of the citizens in that country?
Look, it's a very general, it's a general trait of government, democratic or not democratic, to want to calm the public, because there's an assumption among many of my colleagues in government, whether it's local, American speak as Americans, local, state, or federal, that if the public knows something, the public will panic. No, they won't. If you say, it depends how, again, you have to understand the whole basics of crisis management and crisis communications. You can give exactly the same set of facts in a manner that will cause panic, and we have an expert here, a great journalist, and you can give the same set of facts in a manner that actually helps the public cope. We have seen this time and again, and I say it again, public health agencies across the world sometimes have a difficulty with that. But I want to say also some optimistic things from different angles. First of all, as a primary care physician in the periphery, I work in a very far clinic in the most peripheral area of Israel, and I can tell you, as Dr. Shalmon said here, everybody is really very well acquainted and aware, a very high level of awareness among the public and the practitioners about this. This is true. Everybody is very as acutely aware of the dangers and behaving properly, from what I can tell. I'm speaking about the street. People on the street, they are very aware. They don't go to businesses are suffering, but that's tough luck. Which brings in the question of insurance to these businesses, but that's a different story now. I can also be very optimistic on the side of the policymaker. I have planned tabletops, bioterrorism, and I also field exercise in bioterrorism. Bioterrorism looks completely different. And we have methods and patterns, and again, mathematics, and how we start studying maybe an outbreak is intentional. Intentional looks different, and there are some very specific and very fine. I'm part of the groups that actually wrote this about 25 years ago, and you can catch them very early, but you just need public health agencies that are really aware and follow seriously. We can tell very early on this is possibly intentional or not. So that's the other optimistic.
So this current situation, you're saying, according to your assessment,
it's better than we had during, let's say, SARS, or when we have avian flu or those. Now, the third optimistic side is with China. As I said, I am connected to some of the people in the highest levels in China. The behavior with Chinese government today is way better than it was during SARS. Although President Xi Jinping went into a way different kind of policy than the days of Deng Xiaoping, those guys, the regime today is much more centralized. But surprisingly, in this particular case, they were relatively open. I recall during SARS, I was in Taiwan, and one of the things we're screaming at the Chinese about is, why didn't you tell us? Taiwan is like next door. Yeah, okay, there's an argument between you whether it's an independent country or not, but you should have told Taiwan, your closest, it's part of your country, really. You should have told us. And I remember making that statement in an international conference, and that was the one sentence of this entire conference that was repeated in Chinese media. And ever since then, they were really pissed off with me for a while.
Mr. Oren.
One problem, if we are for a moment going back to bioterrorism or just Saddam Hussein launching bio warheads at Israel, if it hits a certain neighborhood and people would naturally want to run away, their cars, the tires, would probably touch the material. And the Israeli Defense Forces were given orders in such a case to shoot at the tires and to forcefully bar people from leaving the area. We are not there yet. Another problem is an overload of medical facilities, because the Israeli health system is already reeling under a lot of pressures. There's a lack of medical personnel, a lack of beds in hospitals and what have you. And if there is a real outbreak of such a pandemic, people will have to vacate their elective beds, or even if they are justifiably there, in order to let others who have been infected be treated there. And medical personnel could be infected. It could cause a severe crisis.
Well, Dr. Shalmon, I'd like to give you the chance to alleviate those fears and give us a better understanding of how prepared is the health ministry with regard to those challenges.
Yeah, I would just like to agree that it doesn't look like, bioterrorism attack or anything human-made. We are under, as I said, a major work for preparedness. And it's true that we don't have enough medical personnel, and it's true that we would wish to have many more hospital beds. But I think in general, the Israeli public system is properly organized in a case that we will need to switch into an emergency status due to this event. I think we'll do it quite well. I have to say that although we are lacking sources, we are very much trained and people are very much dedicated into the mission of treating patients and working under a very organized system. And practically, as being in Israel, the close connection between the military side and the civilian side allow us to take military tools, not in the bad, rather in the good part of it, and use them, implement them in order to organize system during emergency. And I hope nothing is going to happen, but if so, I believe we will be able to cope.
Many of our viewers are obviously around the world, in Finland, in Estonia, Sweden, and United States, Australia even. Many of them would like maybe to come to Israel and visit as tourists. Is it still recommended for those countries considering all those challenges? How should they deal? Maybe wear masks while they're on planes, or?
It's an individual issue, and each family should make its own decision whether it's the best time to travel now or not. As it is now, many parts of the world are not affected yet. So if you're planning, for instance, to fly to South America, I don't see why not. On the other hand, mostly for countries who already had some cases, it's a good issue, and all of us, including in my own family, we are discussing whether it would be smart, for instance, to fly in 2-3 months now for a family vacation, or rather it's better to wait to the summer. I do agree with you that when weather change, hopefully the infectious rate would drop down, and maybe hopefully the issue would disappear. If not, and there are some experts that believe that it's going to stay with us for a while, and maybe it would disappear only when we'll have a good vaccine against it, then we'll have to learn how to cope and how to live beside it.
Dr. Essmaeel?
Again, being the optimistic, I like the change to be the optimist on the panel. There are some reports, not completely peer-reviewed, about potentially workable vaccine coming out of China. I don't know if that's true, but they're talking like this. There is some indication that some medication that we've used in the past might alleviate symptoms, antimalarials mostly. There's some talk about this, some research coming out. They don't have enough, a series of patients, they have only 200. They need 700 and something to get statistically good. But maybe some of the antimalarials, maybe some of the anti-HIV drugs might work here. We're checking that. That's the optimistic side. Also, another thing about the missile that's going to fall that carries anthrax. I'm saying if I'm going to be attacked with a biological, I hope they're dumb enough to use a missile. Because, well, I think the reason is obvious why. Because, I'd rather them, if they're going to do this, let them shoot us a missile.
Mr. Oren, we're drawing near to the end of the program. I'd like to hear an assessment of each and every one of you. How do you project things are heading to the future? Also, maybe from you, Dr. Shalmon, with a little bit more information with regard to Israel's future steps. Where are we heading from here? What are we to be expected in the near future?
Diplomatically, there was some concern earlier in this crisis that some countries with which Israel is friendly will not respond too positively to travel advisories, much like Israel doesn't like other countries to tell their citizens, please reconsider if you're going to Israel during times of terrorism. But this is now accepted throughout the world that the prudent thing to do, just as Dr. Shalmon said, is for each individual, for each family, to consider whether this is the right time, the right place. If it is not really urgent, you may be going somewhere, and at the airport you will be sent back to your home country, and this is very time critical. It may change from an hour to an hour, from day to day. It's prudent to get as much fresh information as possible.
Dr. Shalmon?
Well, we hope that things would stay as they are, meaning that we do not have this event here. Assuming it's going to have, God forbid, then we would take, I would say, measures and steps which would be in the relevant context of what is really happening. It's a very different issue if we would have like 30 or 40 or 50 or 100 patients, or rather if we would have 1,000 or more. We would try to look for the proper balance between keeping education, economy, normal social life running, and keeping the protection of the public. So some events, like you saw that the marathon on Friday, it's still running, but without international participants. Mm-hmm. And we would, on a daily basis, evaluate the situation and take the proper measures.
I think it's also very important for viewers to know, watch specifically the news with regard to specifics that were given by the health ministries of your respective countries, because there are a lot of news circulating that are completely detached from reality. Dr. Essmaeel?
Yeah, when I like to think in terms of numbers, when you overlay the behavior of this epidemic with others, swine flu, avian flu, SARS, Ebola, others, it doesn't look that bad. Really, it doesn't. It looks like within the parameters. It's a little bit faster than others. It is less lethal, but so far it is still within.
Yeah, but number-wise, we already passed SARS.
Is that what I'm saying? But it's less lethal. They have
The swine was actually a big epidemic, which is still running, but we have now a vaccine for that.
Yeah. Well, unfortunately, this is all the time that we have for today, and I hope we won't have to revisit this topic, but if we will, we'll invite you back. I'd like to thank Dr. Shalmon, Mr. Oren, and Dr. Essmaeel for being here with us, and I'd like to thank our viewers as well, and we will see you next time.
You just watched TV7 Jerusalem Studio. We encourage you to pray for the challenges raised in today's program. If you were blessed by our production, please consider supporting TV7 Israel. The details of our respective bank accounts for donations from Europe and the United States appear on the screen. Your generosity allows us to continue to serve God's calling, to broadcast content that truly matters through TV7 Israel from Jerusalem.